So do you get a lot of parents coming to you with young children suffering from different conditions and wanting to look for a different way of treating them?
I would say yes. So I don't have a quote unquote specialty per se. I think it's really more exciting to kind of take what comes at me. I have noticed since I started practicing, what has come at me has become much deeper in pathology than, and maybe it's because God knows I'm ready for it because I've been studying and learning and, upping my game with this. But it just seems like there's a lot of stuff out there, especially with kids. There's something called PANS and PANDAS. I'm not sure if you're familiar with
Oh,
that.
no.
They are basically a result of strep throat with children and or the resulting antibiotic treatment that goes with it. All of a sudden, kids can turn to very obsessive compulsive behaviors, rage filled. They become very different human beings. Excuse me, after they've had strep and antibiotics. And so parents don't know this. They don't know what's happening, but all they know is their kid is having behavioral problems. They're getting frequent infections and they don't know what to do. Excuse me. So yeah, so people do come because they heard that homeopathy can help. And if and a lot of times for me with me it's more referral business because someone, mom who said, "Oh, my kid got help, with Abby and so maybe you should have your son or daughter or whatever maybe go talk to her too." And so it's really kind of nice how that little network works because, moms know other moms with similar issues with their kids. So, yeah.
Mm.
Yeah,
Great.
so
Well,
we
good for
yeah.
you. Thank goodness for that. I think that's absolutely wonderful. Because these
Mm.
these precious children are vulnerable, aren't they? Their little tiny systems are not yet fully developed. So
No.
they need to be
Mm.
really cared for, don't they?
I think parents need to be very discerning. I think and I grew up in this world where you went to the pediatrician and basically whatever the pediatrician said goes, and the doctor was God, and that was what it was. And now I do have deep respect for medical doctors. I also have empathy for them right now because it's a very different time since COVID
Mm.
where they've had to practice. I think it's very difficult, with the constraints of insurance companies and the hospitals and their practices, and they've gone into, group practices. It's just, I don't know how they do it. I do, as I said, deep respect for them. However, I also think that we as the patients and moms and dads and others who care for others need to be discerning and to look into, when someone says, "Here, I think you should have this vaccine," or "I think you should have this medication, I think it's good for you," like, go do your research. What's the side effect of this thing if you do take this thing? How easy is it to get off of it? What are the long-term effects? And what happens if I don't do it? And is there something else like homeopathy or naturopathy or acupuncture or osteopathy or something that could help the situation that's not going to permanently affect how my body operates?